Hello, my name's Tom. I'm a level 1 nursing student. I was wondering if I can follow you today with Shanae O'Connor.
Sure.
Can I get an S bar on her?
Yeah, she's a 34-year-old female. She weighs 177 pounds. She's a 4 code. She's allergic to trimethoprim. She has renal disease and she's been getting dialysis for that. She's a low risk for falls. She is not at risk for pressure ulcers, and she's on a 1,500 milliliter fluid restriction diet. She came to us with a fever of undetermined origin, secondary to end-stage renal disease, diagnosed 1 year ago, and is on, like I said, regular hemodialysis. She's a type 2 diabetic. Type 1 diabetic. Type 1 diabetic. Had a skin graft infection 3 months ago, which was resolved with IV antibiotics. She has a history of recurrent UTIs, reports of elevated blood glucose over the past few days. The Perla was good. No abnormalities with her ears. Tympanic membranes were clear and intact. Mucosa membrane was good and wet. Mouth was pink. Gums were pink. She wears glasses as well. She hears fairly well, and yeah. Chest expansions were symmetrical. All lobes had clear sounds. She quit smoking 2 years ago. She's a little tachycardic, otherwise she's got regular rhythm. S1 and S2 sounds are present. No murmurs or extra heart sounds. Slight 1+ non-pitting edema in lower extremities. Femoral pulse 2+ bilaterally, 1+ pedal pulse bilaterally. Capillary refill is less than 4 seconds. Abdomen was soft, round, and regular. No visible masses. Sounds in all 4. Bowel sounds present in all 4 quadrants. Patient reports weight gain of 10 pounds over the past few weeks, decrease in intake and decrease in outtake, or decrease in appetite and decrease in intake. Patient reports a decrease in frequency of urination. Urine's dark in color. Her urinalysis came back amber urine with a pH of 4.7 with a specific gravity of 1.005. We're going to treat her for a UTI today because we suspect it, and also because her white blood cell count on our urinalysis was 15, and we want that between 0 and 4, not 15. CBC, metabolic panel, urine culture, and other labs are pending. And her most recent vital signs were taken at 7:30. Her temperature's 101.1, heart rate's 95, oxygen saturation's 96, blood pressure's 136/78. Do you have any questions?
Why is this client receiving this medication? What action does it have on the body?
We suspect she has a UTI based off of her urinalysis and based off of her admitting diagnosis. So we want to go ahead and give her that drug because it is an antibiotic, and what it does is it's going to break down the cell wall or prevent cell synthesizing of the wall of the bacterial cells, thus killing the cells.
What should you question when administering the medication?
Definitely want to question if the patient has an allergy to this type of medication, which she does not, and then you want to question, if it's appropriate for this patient to be getting this medication.
Does it have a therapeutic serum level?
It does not.
And what vital signs must be monitored?
You're always gonna monitor all the vital signs, but really pay attention to the blood pressure and the heart rate. Those are going to be indicative of whether or not the infection is resolving itself or getting worse.
What physiological parameters should be monitored when it's being administered?
You want to make sure that the patient doesn't show any signs or symptoms of an allergic reaction, anaphylaxis being the most deadly one. You want to make sure she doesn't develop some kind of drug rash. You also want to make sure that her IV site is good, and that she's not already having diarrhea, because this medication could cause diarrhea.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to make sure that the patient understands the 5 R's, or the 5 rights to safe patient medication administration. The patient needs to know that the person administering the medication has to ask them, the right time, right medication, right dosage, right patient, time, dosage, patient, medication, and right route. So yeah.
And what about taking it at home safely?
When the patient's taking it at home safely, they definitely need to make sure that they're following the regimen placed out by them, or placed out for them by the physician. A lot of people only take about half their prescription when it comes to antibiotics, and then they get that infection all over again, and then that same antibiotic isn't as effective anymore because bacteria has built up immunity to it.
And what are the side effects and potential adverse reactions?
Again, if she is allergic to this drug and we don't know it, but according to her chart she doesn't have an allergy to it, she could have an anaphylactic shock. She could have a little bit of diarrhea, which is the biggest one. And she could also develop a bit of a drug rash.
And how will you know it's effective?
You'll know it's effective when her vital signs aren't as high, like her temperature, her blood pressure stays therapeutic, and she doesn't complain of amber or dark colored urine. But the most deciding factor is when we get her another urine analysis and we see that her white blood cell count is within therapeutic range, and her culture comes back negative for bacteria.
All right, thank you.
Mm-hmm. Hello.
Hello.
Shanae O'Connor, how you doing?
All right.
My name's Chris. I'm going to be your nurse today.
All right.
Are you having any pain right now?
No.
Alright. Well, we're going to go ahead and give you some medication. You do have the right to refuse it, but we suspect that you have a bit of a UTI going on. Do me a favor. Can I see your wristband, please? And tell me your first and last name.
Shanae O'Connor. I'm 34 years old.
Okay, perfect. Oh, is that an allergy band?
Uh-huh.
Okay. Alright, we're safe. We're safe. Alright, so you heard what I just said, right?
Yep.
Okay, do you have any questions about that?
No.
No? Alright. I need to test your IV line to make sure that it's still good, because what we're going to do is we're going to hang an IV. This isn't going to be a pill, or it's not going to be a liquid. It's going to be something that goes intravenously. If I can get these gloves on. Oh, they're mediums, that's why. Anything good on TV today?
No. Not today.
You've been watching the news a lot?
Yeah, I like the news. Have you been watching the news a lot?
15 seconds, good. Yeah, I've been watching the news a lot. Some crazy stuff going on.
Yeah, it's entertainment.
It's a crazy world we live in, huh?
Mm-hmm.
Alright, so your IV's good. I'm going to leave that there. Alright. First things first, one more time. Tell me your first and last name, please.
Shanae O'Connor,
Okay,
and I'm 34 years old.
And can I see your wristband? Good, and one more time I want to check that allergy. Alright. Just going to scan in our sodium chloride here because that's what we're going to be given with your medication. That's going to help us not to waste any medication. Alright, good. Everything matches up. Now what I want to do is I want to, did I scan? Yeah, I scanned it. Now what I want to do is there we go. Now what I'm going to do is I'm going to uncap this bad boy, maintain sterile technique, and spike it. And we are clamped, so we don't have to worry about any medication running out right now. Now what I'm just going to do, make sure my line's not tangled up. Looks like I'm about to go fishing. You ever been fishing?
Maybe once. I went catfish fishing.
Gotcha. Now I'm just gonna prime the line, get all the air out, all the kinks. Alright. Good. Is going away. We're going to wipe this for 15 seconds. Again, 5, 10, 15. Then we're going to uncap our IV tube, keep it sterile, and we're just going to insert. And now we're in business. Yes, we got a new patient. Yes, it's med-surg. Can I see your wristband? I'm just gonna enter in 824. Good. Now we're gonna go to channel select. Guardrail fluids. 0.9 saline. Yes, this is correct. Rate is 30 milliliters over, I think it's 500. No, I'm sorry, it's 100. Wait, let's look at the order. Yes, 500. And we're going to start that now. Make sure we're unclamped. Twisted here. Alright, let's watch for the 5 drops. One, 2. Come on. 3, 4, 5. I'm just going to write down on my label here the date, time that I'm putting it on, date and time that it needs to be taken off. good. No kinks. Alright, now it's time for the actual medication. Go ahead and tell me your first and last name again.
Shanae O'Connor, and I'm 34 years old.
Alright. Check that allergy. We're good. One more time. First and last name, date of birth.
Shanae O'Connor, I'm 34 years old.
Good. Alright, now we're going to compare the medication with the orders and the MAR. Everything adds up. Good. Once again, gonna get rid of this cap. Gonna uncap this, keep sterile technique, and we're gonna spike it. Alright. And we're clamped, so we don't have to worry about wasting medication. And we're gonna get another alcohol swab. We're going to scrub our hub for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good. Now we're going to make our connection, uncap our sterile cap, and there we go. Now what we want to do is we want to back prime. So, got to hold this lower than the sterile saline. And we're going to back prime it. Good. Keep it like that. We want to hang this guy lower than our medication. And I'm also going to date and time the tubing, date and time when it should be changed. Alright, now it's time for the medicine. And it's going to be that's what I thought. Start. Alright, make sure everything's unclamped. Everything is unclamped. Now we got our guy hanging here. Both tubes are labeled. Piggybacked. Need to watch for 5 drops. One. 2. 3. 4. 5. Good. All right. So do you have any other questions while I'm here?
I think that's it.
Now you seem to, you were asking earlier about, see here in the chart you wanted education on some of the medications that you're getting?
Yes.
Okay, so I printed out some information in regards to this one specifically as well as a few others. So you go ahead and take a read at that.
Alright. Thank you.
Does that look like something you're going to be able to understand?
Yeah, I can read that.
Okay, good. And you said you were in no pain, correct?
No.
Alright. Well, trying to think of anything else. I think we're good.
Alright.
Thank you for letting me do my job.
So were there any pertinent pieces of information you reviewed before administering medication?
I wanted to definitely make sure that the patient didn't have an allergy to this medication. I wanted to make sure that there were no contraindications to this medication present in the patient before I administered it. I wanted to make sure that it was okay with the orders on how I administered it, as well as the dosage, route, patient, all that stuff.
Did this information affect your decision to administer the medication?
It didn't affect my decision to administer the medication because everything lined up the way that it should. She didn't have an allergy to it. It is appropriate for the patient to receive this medication via this route, so nothing was affected.
Did this information affect how you administered it?
It did affect how I administered it because the physician wanted this particular medication administered at this particular rate and via this particular route. So that's why I administered it the way that I did. And yeah.
All right, thank you.